Done.
Welcome back. Today we're going to take a look at the treatment of the mid-thoracic vertebrae. For some of you it may seem redundant because it's an easy area to treat, and we have a patient today who has a problem at that level. So let's proceed. You're going to, Ken, you're going to lay down on your back, please. I'm going to take that wall off. Okay, and the treatment basically, for that treatment we can have somebody absolutely flat on a bench. It's a mid-thoracic, they are in contact with the table, and I'm just going to cross the patient arm completely, and then I'm going to roll the patient away from the table and take an open fist contact that I put behind the patient, and then I lay down the patient on the patient. The thrust will be downward and upward, and it will be basically a thrust using my body weight. Take a deep breath in, Ken. Blow it all out. Upward. Done. Thank you. One way to increase the tension of the caudal arc of tension is basically to slightly increase the lumbar lordosis. And for that, I'm going to ask the patient, raise your pelvis, and I'm going to put the towel just at that level. Now, the mid-dorsal are closer to the spine, and the upper dorsal are also closer to the spine, so much better treatment for that type of patient. I will keep the knee bent at that time, but I can also do it leg extended, both sides. The knee bend will increase the tension on the upper dorsal, and knee extended will increase the torsion, the tension on the mid-dorsal. In order to increase the cephalad arc of tension, we can increase the flexion of the neck. And to increase the flexion of the neck, to optimize the treatment in the mid-thoracic, we can start from a seated position. So basically I'm going to cross the patient hands. He can still keep his legs straight, and there the treatment will be with my head against his head to hold it, down and thrust. The other type of treatment and contact that we can do is asking the patient to put his two hands behind his neck. And now it's easier with hyperflexible patient, young patient, etc. And we're going to forward the patient neck in full flexion, and we're going to just unroll him on the table as we instruct him to breathe out. Take a deep breath in, breathe out. Beautiful. And body weight at the same time to treat the patient. The treatment of the upper dorsal are a little bit different in the sense that they require the patient to have a direct contact between the table and the upper dorsal. In order to treat the upper dorsal, we're going to need to increase the cervical arc of tension, but the lower arc of tension also drastically. So what we're going to do is something very different, and we're going to put the patient back like that. We're going to cross his arm, and we're going to ask him to put his feet on the table. And now, please could you bridge, please? Bring your pelvis up. And as you do that, we have a really good type of positioning for the treatment of the upper dorsal. So we move the patient off the table, take a contact, instruct him to breathe in, and blow it all out, and run. Excellent treatment for the upper dorsal, safe, and we can go up to T1. Okay, we have a patient extremely flexible. She teaches dancing. So because she's flexible and we need to treat her on the upper dorsal, we're going to use a little prop, basically, to increase the cervical arc of tension and increase mostly the lumbar arc of tension. So if you can lay down on your back, my dear. And we're going to have a full head flexion. And now you're going to bridge, please. Raise your pelvis, bridge completely. Beautiful. Relax. Okay, and now we have the patient knee bent with the pelvis raised up. and we have a full tension on the upper dorsal, which are in very close contact with the table. And I repeat, we have a firm type of table. So we're going to have the patient cross her arms. Because the female has breast, so we can do two things. We can cross them and ask them if they have pain, or we can ask them gently to put their hand like that, and with their elbow like that. It may be more comfortable for them. Then I'm going to roll her off gently, take a contact specifically at the area that I want to treat, and I'm going to ask you to take a deep breath in. This way is more comfortable?
Yes.
Oh, good. Take a deep breath in. Blow it all out. And at full inspiration, I will use my body weight and gently drop it. Done. Very nice and very easy. Now we're going to look at the treatment of the lower dorsal. The lower dorsal requires, basically, a very good tension to be put on the whole upper back. And basically, we need also to have full flexion of the lumbar in order, basically, to treat this area. So the best way to assume that, and it's a technique that seems a little bit odd, but very, very effective. We're going to cross the patient's arm. We're going to take a contact just between the patient's legs to bring him in full flexion. Right close to the patient, I instruct him to breathe in and breathe out. I'm going to hold his head in full flexion, take a contact on the lower dorsal, and just go along with his leg and treat the patient. Now, remember, the treatment of a patient dorsal depends on three things mainly. How soft the table is, the morphology of the patient, and the type of contact that you want to take.